After the operation, all patients will be taken to 10 ICU. This is our lung transplant intensive care unit. All patients will have a breathing tube, have large IVs in their neck, and will be sedated. This is all normal. We will do our best to take the breathing tube out as quickly as possible, but every patient reacts to transplant differently. And some patients need the breathing tube longer to let the lungs heal from the trauma of being transplanted. Additionally, some patients will need another form of life support called ECMO. This stands for Extra-Corporeal Membranous Oxygenation, which is a fancy way of saying that the new lungs are not functioning as they should yet and need additional oxygen support. You can think of this as a kind of external lung. It adds oxygen to the blood and removes carbon dioxide so the lungs can rest. Most of our patients do not require ECMO and have the breathing tube removed within the first 24 to 48 hours after surgery. While you are waking up and perhaps confused, there will be nurses, respiratory therapists, doctors, nurse practitioners, and your family at bedside, giving you reassurance about the surgery and orienting you to where you are and what is happening. In addition to the breathing tube and large IVs, patients will come out of the operation with several chest tubes and a Foley or urine catheter. Shortly after arrival to the ICU, an epidural catheter will be placed for pain control. We expect our patients to be out of bed and walking within hours of removing the breathing tube, so be prepared to get up and work hard right from the start. All of our patients will spend a minimum of 4 days in the ICU. During that time, we are working on physical rehabilitation, as well as starting the immunosuppression regimen and weaning them off the various machines that were necessary during surgery. They will receive bronchoscopies daily until day 5. This is a procedure that involves using a scope to look into the new lungs and clean out mucus that has accumulated. After the 5th day, we will wean the bronchs to every other day or even every couple of days. Once we've determined the recipient is stable to leave the ICU, we will transfer them to our 10th floor step-down unit. Usually, this is when we start focusing heavily on physical rehab, nutritional rehab, and discharge teaching. It is expected that at this juncture, the family members and caregivers make themselves available to the team for multiple days of education sessions. Transplant is a new life, and with that, both the patients and caregivers must learn how to live in this post-transplant world. Education is critical to adapt to the new medications and requirements that come with transplant. Typically, patients are on the step-down unit for 7 to 10 days. Our average hospitalization course from surgery to discharge is about 2 weeks. If there are complications, this may be longer, but rarely is it shorter. Transplant is a new way of life, and although I can tell you what usually happens, every single patient responds differently and has a different course. We will be with you and your caregivers every step of the way, and will always spend as much time as necessary to answer questions. Thank you.